Drug classifications and how they affect your driving, Part 2. In contrast to stimulants, depressants have the opposite effect. They hinder, reduce, and slow down biological activities. Depressants can cause drowsiness, lethargy, loss of bodily sensations, muscle paralysis, poor coordination, severely slowed digestion, slow heart rate, sluggish breathing, and a fictitious sense of serenity and well-being, among other short-term side effects. Pharmaceutical depressants are widely used as sedatives to treat sleep disorders, pain relievers, and anti-anxiety drugs because of their effects. Typical depressants include 1 alcohol, 2 antihistamines, allergy medication, 3 pain relievers, 4 opioids, such as OxyContin and heroin, tranquilizers, such as Xanax. The prolonged or excessive use of depressants can cause biological processes to become so sluggish that they eventually stop. Prescription painkillers are particularly risky since the patient gradually need more and higher doses to experience the same amount of relief as the body becomes accustomed to their effects over time. Overdoses on prescribed painkillers are tragically common because of this. Drugs that treat pain depress the senses and obstruct the neural pathways that alert the brain to pain. They are frequently recommended to treat chronic inflammatory illnesses since they can help lower temperature and reduce inflammation. Sadly, they may also result in 1 extreme sensitivity to light, 2 heart attack, stroke, and heart failure are all at an increased risk, 3 liver injury, 4 a blood thinning condition, which can lead to excessive bleeding, 5 lining of the stomach deteriorating. Patients who use anti-inflammatory painkillers long-term run the risk of dying from the last 2 harmful side effects. When stomach acid comes into contact with the stomach wall as the stomach lining is being eroded away, ulcers may develop. Internal bleeding may occur in the event that the patient additionally has thin blood. Many painkillers are sold without a prescription, usually after being mixed with other, less dangerous medications. Opioid painkiller containing medications are extremely risky and addictive, and as a result, they are subject to tight regulation. Any painkiller taken in excess, whether it is over-the-counter or not, has the potential to be lethal. Advil, Tylenol, and aspirin can harm the liver permanently. Opioids like morphine and codeine can cause nausea, delayed breathing, skin irritations, constipation, and depression. They also pose a higher risk of addiction and overdose. More stronger opioids than those mentioned above, such as heroin, hydrocodone, and methadone carry a higher risk of physical addiction and overdose. Hallucinogens. A hallucinogen is any drug that changes how a person sees themselves and the world around them. Extremely intense sensory hallucinations, vision, smell, taste, and touch, mood swings, time dilation, and a keen sense of detachment are all possible effects. Some naturally occurring hallucinogens and some synthetic ones are both used. Because they are influenced by the personality and current mental state of the user, the effects of hallucinogenic drugs differ widely from person to person. While many people claim that using hallucinogenic drugs was overwhelmingly positive, others say that it had terrible negative repercussions. It is impossible to predict how you will respond to a hallucinogen, however typical side effects include 1 panic, fear, and anxiety, 2 depression and thoughts of suicide, 3 perspiration, fast breathing, and nausea, 4 heart rate and body temperature have dangerously elevated, 5 a fictitious impression of joy and well-being, 6 vivid hallucinations and paranoid delusions, which may be pleasant or incredibly frightening, 7 psychosis, which may continue even after the drug has left your system. The most popular and well-known hallucinogen may be marijuana. Many people claim that marijuana has a depressing impact, while others say it has stimulant-like effects, making it difficult to categorize this strange medication. Along with the dosage of the drug being taken, the diversity in effects appears to be influenced by the psychological and physiological makeup of the particular user. About 1 in 7 persons in the United States were thought to regularly or occasionally use marijuana in 2017. The drug's capacity to induce feelings of well-being, hallucinations, and an altered sense of self make it popular among recreational users. Even while there is less chance of overdose and death from marijuana use, in fact, there has never been a case where this has happened, the drug can still be quite harmful. Marijuana use can make it difficult for the user to defend himself or respond correctly to their immediate circumstances since it detaches, disorients, and confuses them. To attempt to operate a vehicle while in this state of mind would be highly risky. Although marijuana is uncommon to result in overdose death, it can harm a person's mental health permanently. Memory loss, fear, paranoia, anxiety, and full-blown psychotic episodes have all been linked to it.